Hello and welcome to Yoga Fit with Ed and Ross. Today we will practice Matsyasana. So lie on your back, lift your pelvis slightly off the floor and slide your hands palms down below your buttocks. Then rest your buttocks on the backs of your hands. Don't lift your hands off as you perform this pose. Be sure to tuck your forearms and elbows up close to the sides of your torso. Inhale and press your forearms and elbows firmly against the floor. Press your shoulder blades into your back and with an inhale, lift your upper torso and head away from the floor. Then release your head back into the floor depending on how high you arch your back and lift your chest. Either the back of your head or its crown will rest on the floor. There should be a minimal amount of weight on your head and avoid crunching your neck. You can keep your knees bent or straightened. It's on your comfortability. Keep your thighs active and press out through the heels. Hold your breath. Stay for 10 to 15 seconds initially. Then you can increase the count as you practice daily. With an exhalation, lower your torso and head to the floor. Draw your thighs up into your belly and squeeze. Traditionally, Matsyasana or fish pose is performed with the legs in Padmasana. Since Padmasana is beyond the capacity of many beginners, we will work with our legs extended straight and pressed against the floor, which will also protect your back. I've noticed that beginners sometimes strain their neck in this pose. If you feel any discomfort in your neck or throat, either lower your chest slightly toward the floor or put a thick folded blanket under the back of your head. I don't usually recommend my students to depend on props for the asanas, as with practice and 10 reps a day gets you to your desired position. Matsyasana provides some amazing benefits to your body. It helps in reducing fatty liver or other liver disorders, effective for counteracting hypothyroidism in thyroid health. The neck and throat are stretched during this exercise, thereby stimulating and increasing blood flow to the thyroid glands. Matsyasana reduces the stiffness in muscles around cervical, thoracic, and lumbar regions. It also strengthens the lungs, a good exercise to improve the health of asthma patients. It increases insulin release and helps control levels of blood sugar, hence improving blood circulation in pancreas. Avoid if you have undergone any surgery in the past, if you're pregnant, especially until first trimester, if you have low or high blood pressure, if you have sleeplessness or migraine headaches. Keep practicing yoga every day and I'll see you soon.